Good evening, everyone. Thank you so much for coming. We're really excited to do this presentation tonight because we think that an informed city council is crucial to strengthening housing security, not only in the city of Bloomington, but in our South Central Indiana region. So we appreciate that you're coming tonight with an open mind. We have a fantastic lineup of speakers to talk to you about some of the details of the homeless response system and housing security work that's being done. We'll have some time at the end for Q&A, but we're really hoping to cover a lot of ground tonight, and so a little bit of apology in advance because you are going to get a lot of information. It's not going to be exhaustive because we do only have an hour and a half. But we are going to be following up with more information, links to some of the information that's referenced by the speakers. And obviously, we are open if there are any follow-up questions that we can't answer tonight. We will be able to follow up with you by email or additional phone calls. So I'm Mary Morgan with Heading Home of South Central Indiana. We will be talking more about Heading Home in a bit. But we're going to, first of all, start off with an overview of the homeless response system. We'll be getting into details of that work later on, and then specifically we'll have a section about what City Council can do to strengthen housing security. So I would like to introduce our next speaker, Emily Pike. She is chair of the South Central Housing Network, as well as executive director of New Hope for Families, and a mother of twins.
Hi, good evening, everyone. I'm Emily Pike. As Mary said, and I think I know most of you in my role as executive director of New Hope for Families, but I also currently serve and have served for the past 2 years as the chair of the South Central Housing Network. There you go. The South Central Housing Network is actually sanctioned by the Indiana Housing and Community Development Authority, affectionately known as IHCDA, which is basically the state version of HUD. And IHCDA breaks the state up into 16 regions in its continuum of care to serve folks impacted by homelessness. So we are in Region 10, which is 6 counties, which is Monroe, Morgan, Martin, Lawrence, Owen, and Greene counties. So most of our service providers are right here in Monroe County, as you probably know. And we serve folks impacted by homelessness in a variety of ways, but we're made up of 2 different kinds of providers. Some of us are direct service providers, and others are what we call advocacy members. So our direct service providers provide emergency shelter, transitional housing, or permanent supportive housing for folks impacted by homelessness. Mary, do we have someone who's talking about those 3 things? Yeah, okay, Chase, I think, right? So you're gonna hear from Chase a little bit about how each of those things serves folks impacted by homelessness. The most important thing is that the Housing Network brings those folks together, and we talk about what is the best way to allocate funds in our community, allocate resources in our community. In order to be eligible for state funding, homeless serving agencies have to be a part of this group. So that's really important. The other half of the group are advocacy agencies, and those are folks who are there because they serve folks impacted by homelessness either not through shelter or housing, or they serve them through shelter and housing but not with a state grant. So for example, Wheeler Mission is a part of the network, even though they do not serve folks with a state grant. So most of the folks who are there as advocacy groups, though, are there and they are connected in some other way. So for example, CJAM spends some time there, our Community Justice and Mediation Center, because we know that they do a lot of work with eviction prevention, and that's something that is related to the homeless response system, but doesn't deal with folks who are immediately homeless right now today. Other agencies like that include the Bloomington Housing Authority. We're going to hear from Leon here in a little bit. They're an integral member. Centerstone is a member in its capacity of offering permanent supportive housing, but also in its capacity of offering mental health supports for folks. So there are other agencies like that. Habitat for Humanity is a great example of an agency that doesn't serve folks while they're homeless, but is nonetheless housing related, and so is always invited to be at the table in that way. So the housing network is probably the way in which the most people come together at the table. A lot of us also are United Way member agencies, but this is a time for us to come together and just be focused on housing. We're also really importantly tasked with creating the housing inventory chart, which talks about the number of shelter beds that we have in our community, also the number of transitional housing beds that we have in our community. And then we're also tasked with completing the PIT count. PIT stands for point in time. I think someone else is going to talk about that later. Yeah? Maybe. Point in time count is when we count all the people who are homeless on a given night in January. So those two things inform how we think about providing services. They also really importantly inform how the federal government allocates monies to the states based on how much our utilization rate for a housing inventory chart and the number of people that we count in the PIT count. So if we have a lot of shelter beds that we're not using, that counts against us when we get federal grants at the state level. And so that's why those two numbers are really important in addition to understanding how we can best serve folks. And that is what we do at the South Central Housing Network. Did I do it, Mary? Yay! Yay, I did it!
Thank you, Emily. It's rare to see the presentation like that, juggling a baby too, so props for that. I would next like to introduce Melissa Burgess. Melissa is with HealthNet here in Bloomington, and she's going to talk about street outreach. Thank you.
Yeah, hi, I'm Melissa Burgess. I am a social worker with our HealthNet Homeless Initiative program and excited to talk about outreach. So HIP is part of the Healthcare for the Homeless. I'm not sure if folks are familiar with that, but I took this outreach definition from the Clinicians Network, maybe defined as fundamental bridge between unstably housed individuals and available services and resources. So really kind of what outreach is literally meeting folks where they are. It's feet on the streets. It's going into the encampments, under the bridges, on the sidewalks, into the alleyways, into public spaces where folks may be living or sleeping. And so really one of the main takeaways I hope that you take today is the bulk of outreach is about relationship building. So it's about building trust and rapport. So meeting them where they are is the first bridge to that. And so again, our folks are unseen, they are discriminated against, they are invisible, and so our outreach workers work really hard to bridge that gap and to build that trust and rapport and help them be seen as people. So basically with outreach, again, feet on the streets, and so that's assessing for mental health, substance abuse, mostly engagement, linkage to housing, medical, psychiatric care, things like that, but then also meeting basic needs. And that could be as simple as blankets, food kits, hygiene kits, water, things like that. So there are several street outreach folks that do streets here in Bloomington. You may be familiar with a lot of them. The police department has the downtown resource officers, the DROs, also known as the white shirts. So they hold a weekly meeting where outreach workers come together and they staff casings, they communicate, they collaborate on a weekly basis. The fire department also has community care coordinators. They work with housed and unhoused folks. So we work closely with them as well. They may, for the frequent 911 callers, maybe somebody who's unhoused. So they'll call our medical team to see if we can help intervene. Centerstone has two different teams. They have the PATH and the ACT team, so they have outreach workers as well in the encampments. City of Bloomington, they have to have an after-hours ambassador. He's huge because he works with the folks overnight. So he's really concentrated in that downtown area, again, engaging folks who are in the alleys, maybe sleeping on benches, things like that. So he'll give us heads up, and again, just that communication piece with them. Our street medicine team, of course, Indiana Recovery Alliance has outreach workers as well, doing safe use training and needle exchange and things like that. And then IU Health Positive Link, so working with the folks, the HIV/AIDS general population. So HIP, just quick, are a lot of you familiar with what VIM used to be, Volunteers in Medicine? Okay, so VIM became HealthNet back in early of 2020. And so when that happened, that opened the door to our Homeless Initiative Program team. We are in Indianapolis primarily, and we kept hearing from Shelley, the clinic manager, hey, we need medical and psychiatric services, access to medical and psychiatric services for folks on the streets in Bloomington. We had some ARPA funds, and so we expanded down here to Bloomington in November of 21, really with the focus of listening to the community on what the needs were. And we kept hearing, we need access to medical and psychiatric care. So then we grew, and here we are now a team, a street medicine team, and I'll get into that a little bit more, but our team's focus is transitional medical care, social housing support, and connection to community resources for anybody experiencing homelessness in Bloomington. And that's a picture of the VIM clinic. And I'm super excited to say we just moved our HIP team. We outgrew the conference room at the clinic, so we have our own space behind the clinic in a separate building. So that was exciting. Street medicine. Super excited to talk about what our team is. Catch me if I'm on time. And so we have 2 full-time family nurse practitioners on our team now, and then 1 psychiatric nurse practitioner. And we have 2 amazing street outreach case managers who are here. Talk about you guys in a minute. So we are on the streets pretty much 5 days a week. And so our nurse practitioners are in the encampments. They're on the streets. We also have some site-based clinics at Wheeler Mission, Middle Way, and we're waiting on HRSA federal approval to start a clinic at the library downtown, as well as Crawford Place. So super excited about that. So we're providing acute care. Basically, this is a picture of Abby. We are drawing labs. We are doing a tremendous amount of wound care for folks, and then also prescriptions, linkage to primary care, linkage to specialty care, things like that. And then our psychiatric nurse practitioner is also in the camps and at the clinics as well. So going out, meeting people where they are, doing the assessing, providing medication and care for folks with psychiatric symptoms. I also want to talk real quick about psychiatric, our MP, really being a bridge. Both of our bridges, medical and psychiatric. But say, for example, the hospital, somebody has been stabilized on medications, but it takes months to get into psychiatric care at one of the community mental health centers. So our psychiatric nurse practitioner is intervening, providing medication to hopefully keep that person engaged and then also stabilized on their medication. Our outreach case management. So we know housing is healthcare. And so, but with the medical and psychiatric care is a heavy, heavy, heavy lift with housing. When we first got down here, I didn't really think we were gonna do housing. Okay, and so we knew that we had to do that. And so our street outreach case managers do a heavy lift with housing. So we participate in coordinated entry, which I know Danielle's gonna talk about here in just a second. And then we help get people housing ready, which means you're getting documents ready, birth certificates, social security cards, IDs, any type of barriers. They work closely with parole and probation, any type of barriers that are created to prevent somebody from accessing housing. In addition to that, once they're pulled from housing, then we do housing search and placement. So they're taking folks to meet with landlords, to complete applications. If they're going into permanent supportive housing, do that warm handoff so that, again, it's about relationship. If we have the relationship with somebody, we can say, hey, we're gonna pass you off to Danielle. We trust Danielle. So hopefully we can do that warm handoff for that person to Danielle into housing. So it's a huge heavy lift. So we do that holistic case management as well. And thank you. Okay.
Thanks, Melissa. As you can tell, we're presenting a spectrum. So we started with an overview, talking about street outreach. Now Chase is going to give some information about housing crisis and emergency shelters.
Thanks, you all. My name's Chase Teggington. I'm the shelter director at New Hope for Families. When people experience a crisis in their life, it can implicate a lot of other parts of their life. Just as famine in an area can explain the rates of hunger, housing scarcity and affordability can explain the rate of homelessness. When toilet paper was scarce and expensive during the pandemic, a chaotic event in your life could implicate your toilet paper supply. If you fled domestic violence, if you had a mental health episode and couldn't get out of bed for several days, if you had a serious physical injury and went to the ER, and you didn't get over to Kroger, you were going to be out of luck with toilet paper. And if you had a broad, persistent lack of resources, or you were living in poverty, probably meant that you didn't have the money or social connections or family connections for anybody to help you and give you any toilet paper. So that was a serious issue when toilet paper was scarce and expensive. Same thing is true in communities where housing is scarce and expensive. So homelessness is tightly related to that. These other issues of life, serious mental health issues, addiction, physical health, the things that precede an individual's housing crisis that could lead to homelessness are really important pieces that go together. But the root cause, of course, is the housing itself. Communities where the local government has chosen to use its land in a way that makes housing unaffordable and scarce are communities where homelessness is really intense. So I want to talk to you about what we do when people face that housing crisis. Shelter fits in even if homelessness is rare, brief, and non-repeating, which is our goal. A housing crisis happens, shelters are there. The housing inventory chart that Emily was talking about says how many beds we've got available to respond to a housing crisis. And then we try to move people very quickly back into housing so that they don't have to languish in that chaotic situation anymore. In many communities, a more accurate picture is that our ability to respond to those crises overflowing. We can't quite respond to all the crises that happen at once. In our community, we're really close to being able to shelter 100% of the people most of the time, especially in winter when we open extra room. But in summer, sometimes we're not able to respond, and people sleep outside or have to sleep on the streets and can't find shelter. In some communities, like the California Bay Area, 30,000 people sleep outside or in shelter on a given night, and they can only shelter 30% because they've let their housing scarcity issue get away and run away from them. Here, this is our region that Emily was speaking about that participates in our South Central Housing Network. Here on the right are our local Monroe County and City of Bloomington overnight shelters, and there are a few more in the counties surrounding us. Wheeler Mission provides overnight shelter in a building for women and in a building for men, and during the day they have access to case management and food and other essential services. So they're also the site for our winter emergency overflow shelter, so they're a really big player in making sure people can stay somewhere safe out of the elements. In addition, Beacon operates an overnight shelter for men and women. There's a men and women's bunk room. They open in the evenings, serve dinner, give people shelter and case management, and then they close during the day. Beacon also offers a daytime resource center called the Shalom Community Center. People can go there, crucially, even though it's not open overnight, it's a crucial place for people to go who slept outside last night. They can get showers, laundry, access to case management, and the services that you could get at a shelter, but may or may not be getting at the shelter you're staying in. Middle Way House provides shelter for people who are fleeing domestic violence. And even though they have a smaller population and a more narrow reason for coming to their shelter, if you're staying there, you're in a housing crisis, you're in a shelter that qualifies you for the same kind of programs that we use to respond to other housing crisis and in shelter. Last, New Hope for Families shelters families. Mainly, my rule of thumb is that the beds there are for kids' heads and the families who come with them. That is a new phenomenon that whole families are being chipped out of housing and not able to respond. So that's showing you the growth of the housing crisis that even this population is struggling there. So we shelter families and children specifically. We don't turn the lights off at the end of the day if we're aware of a child that's sleeping outside or in a vehicle. And thanks to some partnerships with the city and some really helpful allies there, we've got some funding and backing to make sure that children don't sleep outside. And we know that the city has partnered with all of us really meaningfully to make sure that our shelter capacity is really close to what it needs to be. And then more broadly, there's some other shelters that you can see there on the right or on the left of your screen. right of your screen. All of these people qualify, all of these people in these different populations qualify for a couple different housing interventions, some funding that gives them rocket boosters to get out of shelter fast, programs that either pair them with a lease that has a subsidy, it makes their housing affordable based on their income, or it does things like pay your deposit and rent up front so you do not have to wait around saving up in shelter to pay those costs, and a handful of other programs. In the abstract, that is a great idea. In the particular, those programs are operated by some really faithful and great partnerships right here in our community. And to make sure that everybody gets fair access to those and the most vulnerable people get into the highest impact interventions, we've all got to gather around and coordinate entry into those programs. And Danielle Sorden is going to come up and talk to us a little bit about that.
Hello, my name is Danielle Sorden, and I am the Director of Housing First Programs for Beacon, which means that I'm the manager of the Crawford program. I'm also the regional lead for coordinated entry, so I try to coordinate all of the local agencies and the agencies in the surrounding counties to try to get the people housed that are living in homelessness right now. So what is coordinated entry? Basically, it's a system that's designed to include all of the agencies and programs so the highest need individuals in the whole region get housed. Before this system came about, we saw a lot of agencies that were working to house their own clients in their own housing programs, or the housing programs that they had some sort of direct referral line to. So what coordinated entry does is it makes it so it's not possible for agencies to do that anymore. If you receive funding from the state or federal government, you're required to participate in this process. And that means that all of the homelessness serving agencies, so shelters, day centers, street outreach, and all of the permanent supportive housing and rapid rehousing programs all have to coordinate together. So we all use the same assessment. You can see in the second section, it's called the VI SPDAT, which is the Vulnerability Index and Service Prioritization Decision Assistance Tool. Basically, I wrote it down on purpose, Emily. Basically, what that means is we're assessing people for their vulnerability. We're using about 24 questions to ask them about physical health, mental health, substance use disorder, interactions with legal services or emergency services. Are they taking their medications? Are they getting medical care? The more problems they have, the higher vulnerability they have. And that's how our coordinated entry list is sorted. You put people into the system, the list automatically sorts them by vulnerability, and then the people that tie, whose scores tie, are sorted by the length of time that they've been homeless. So the people who have the highest vulnerability and the longest amount of time homeless in the entire region get housed first. That means that somebody from Greene County might get housed in a Monroe County program that's never heard of them before because they really are the most vulnerable person in the entire region and not just the ones that I happen to know. So the list is actually broken up into two different sections. On the lower score scale is rapid rehousing. Those people are less vulnerable. They can be housed and they can probably maintain their housing with a short burst of funding and assistance. So they will get some deposit assistance, rental arrears assistance, utility deposit assistance, and some rental assistance and short-term case management in order to help them find employment or help them do their applications and that sort of thing. And then once they've been settled, they should be able to go on without assistance. The people with the high vulnerability go into permanent supportive housing. And they do have to meet the eligibility requirements, so each program may not take the very top person on the list. The person who's eligible for that program may be a few people down on the list, just depending on the situation. And permanent supportive housing means that those people have been determined to have high enough vulnerability that they're going to need ongoing rental support. They're going to need to have ongoing case management, maybe for the rest of their lives, in order to maintain housing. And that's how we keep people from being chronically homeless. The quality control for this situation, backtracking, I do find this very effective. What we're looking at is who's most likely to die on the street without housing. Let's get them off the street and into housing. I find the assessment tool and the system to be very effective. But we have found that people's scores don't always determine how vulnerable they are. So we have what's called a case conferencing system, which is where all the agencies, homelessness, serving, and housing, we all get together, along with sometimes the BPD street outreach people, usually the VA attends, and a few other agencies, and we all say who has an opening and who they think on the list should be their next referral. And then people like the HealthNet case managers who are actually seeing the people out on the street, or the other street outreach or shelter people can say, actually, there's a person who has 5 different physical health problems, and they're only getting 1 point on the assessment for physical health, and we really think they're the most vulnerable person on the street right now. If there's a consensus, then we make that person the next person housed. So we don't take the human element out of this. We don't take the knowledge and skill of our workers out of the situation, but we do try to eliminate ways that human workers can have favorites or can make recommendations based on what they know about this person when they really don't know what's going on with this other person. So as I said, some of the benefits to this is that it forces agencies and programs to work without favoritism. And I don't mean conscious favoritism. I just mean that sometimes a caseworker is working with a person and they think, gosh, this person would be great for this program. And then they start advocating for that person to get into that program. And that's great. That's good. We want all of our caseworkers to advocate for their clients, but we want to make sure everyone is getting the same level of advocacy. The system is also holistic. It encourages way more communication and collaboration than we had with our agencies before coordinated entry. It's hard to resist talking to other agencies about what's going on in your program when your funder is saying that you have to do it. Some of the challenges that we face are that some of the higher vulnerability residents are harder to house and they're harder to keep housed. We have a terrible plight with landlords increasing their criminal background requirements in this town, and even their credit checks. Even for programs that are paying 100% of the rent, we still sometimes get turned down because of bad credit. We're getting turned down because of misdemeanors. Once people have been in homelessness for many years, it's pretty hard to find people that don't have any criminal background at all. You can't live outside without doing something against the law. Another problem is that scores can be manipulated by dishonest input. It's rare, but we have seen situations where some workers will kind of aim in one direction or another with the scores so that they can try to get someone in the kind of housing program that they think that person would go to. I don't think that's an avoidable situation with any system. So again, I think that coordinated entry really is a very highly functioning system. So this is kind of a repetition of what you've already seen so far. I haven't really talked about emergency housing vouchers. That is another agency that we make referrals to. Bloomington Housing Authority's emergency housing vouchers. We've been working with those for almost 2 years now, and unfortunately, we're almost out of them. So that was a one-time benefit from the federal government as far as we know so far. Also, SCAP has emergency housing vouchers, and we go through IHCDA and then SCAP to make those referrals. And then you can see veterans have some rapid rehousing, and Beacon does as well. and then you can see who has permanent supportive housing in our region. So that's pretty much it for me.
Thanks, Danielle. I hope you can see that there are so many people who are working hard and who are experts in this field, and to me, it's really inspiring just to see how everybody's coming together to address this problem. And one of those people is Leon Gordon with the Bloomington Housing Authority. Leon?
Good evening, everyone. Leon Gordon, Administrative Director with the Bloomington Housing Authority. I'll talk a bit about our programs and how they fit into the continuum of care here. Section titled the Housing Stability Effort. So the mission of the Bloomington Housing Authority is that we strengthen opportunity, beginning but not ending with housing. So seeing housing as the beginning, and then making sure that we provide the supportive services to help folks sustain that housing and ideally enhance their personal capacity. I'll talk a little bit about our programs and give an overview of those programs that support that pathway towards personal capacity building and just general housing stability in the community. We own, operate, manage 3 income-based housing developments, one on the north, two on the north side, the Crestmont neighborhood, and the Reverend Butler and the Walnut Woods, formerly public housing. All you need to really know about that is that we've just changed the income structure, but we have a total of 320 units of affordable housing. And our biggest program is our Section 8 program, in which we administer vouchers for housing vouchers on the private market, on the private rental market, about total 1,600. In addition to that, we have some new programs that we're rolling out. The Landlord Risk Mitigation Fund program, which I'll talk a bit about. It offers financial incentive for landlords to rent to Section 8 voucher holders and residents with housing barriers, much like Danielle was speaking of folks getting denied for credit and things like that. And then we're also venturing into development with the establishment of our Community Development Corporation. And we'll talk a little bit about, just briefly, about the pathway towards affordable home ownership in the community. Just wanted to give this higher level overview again of what we do fundamentally. We are administrator of federal housing assistance. We're also a landlord for affordable housing, and we're a supportive services provider, which distinguishes us from typical landlords, that we have those supportive services on site. And now we're venturing into affordable housing development. So what does affordable housing look like in Bloomington? I asked that question because to really understand the power of Section 8, you have to ask that question. There's a limited affordable housing stock in which places where you can live where you know the rent is not going to change substantially or it will maintain affordability. Our community is one of them. There's like Henderson Court, other LIHTC communities that keep reduced rent, like College Square. They rebranded apartments. And then outside of that, it's really a question of affordability. This is primarily a student market. And so the power of these vouchers being leveraged in the community really is trying to make the unaffordable affordable for those who otherwise wouldn't be able to rent. And so using those to the extent we have affordable housing, to the extent that we're able to leverage those on the existing housing stock, because the housing stock is it's limited, as we know. So what is it? Income-based subsidy that covers the cost of rent and utilities, limiting the expense to 30% of household income. Voucher holder uses that to rent a rental in the private market. I'm going to use this actually. Hello. Okay. And so, for example, if you have a senior, this is an actual resident making $841 a month, Social Security income, The rent for a one bedroom, and this is actually our community, that's why the rent's so low, $662. And for the rent, so their portion of rent would be $242. And we provide the rest of a portion of assistance, $420 through the housing assistance payment. And that support, the power of the program is that the support is adjusted relative to a loss of income. So this means for working families, if they lose their job, they're able to get the support they need to maintain housing. And so the qualification is you must be at or below 50% AMI for Section 8 vouchers. And that means for a family of 4, no more than $42,650 in annual income. Some program statistics about Section 8. So nationally, only 1 in 4 people who actually qualify get a voucher. We provide, as I mentioned before, 1,600 vouchers in this Monroe County area. Our average household size is 2. Median income of $13,402. 38% of our households have children, 24% have seniors, and 44% have a household member with a disability. Program challenges, and speaking on these challenges, I'll touch on some of the programs that we're rolling out to try to address those challenges. Only 63% of the participants that receive vouchers are successful in leasing up in this community. And so that comes from general landlord apprehension towards the Section 8 programs, and the fact that 98% of occupancy within, we're at 98% occupancy reported within city limits. So this is having an open unit is an issue. And then the biggest issue outside of landlords not accepting the program is the fact that we're priced out. And so the available units, they just don't work with our payment standards. And one of the things you have to understand about Section 8 is that it's based off the fair market rent set by HUD. And if you see for 2023 for a 1 bedroom, it's $957 for fair market rent here in Bloomington. Our program and HUD allows us to go up to 110% of FMR. And so currently we'll pay out $1,052 for a 1 bedroom. And so even in the midst of doing that, going above FMR, some of these places are just not affordable and don't work with the program. So to help with landlord apprehension, we were grateful to receive funding from the city of Bloomington, Heading Home, and also the Community Foundation, accumulated to a pool of $316,000 to support lease-up efforts for Section 8 clients, as well as income-eligible households with housing barriers. And so these are folks coming from programs like my community partner spoke of that are trying to get housed. And so what we do is we provide a financial backing of up to $2,000 to decrease that the risk of financial loss. And so it's in the form of a reimbursement to the landlord. And we were also given an additional $50,000 by the Community Foundation to provide deposit assistance. Many of the folks coming off of our wait list, they don't know when they're coming off the wait list, and so deposit assistance was something we needed to make part of the equation in getting folks housed immediately. And so what we'll do is we'll cut a check, and then we work with the family to do a flexible zero interest repayment agreement. And so we're also partnering with the city and R101 to try to reduce that cost in instances where folks have very limited income. So we're also inviting landlords to become partners, referral partners. So we're getting out, meeting with landlords, telling them about the program. So meeting them at the point of denial. And so if they're saying, hey, your credit doesn't quite cut it, well, we want them to refer that client to us for endorsement. I only got like a minute left, so I'll kind of, the big thing to know about that program is that it also comes with liaison support. And so we're there, we do quarterly check-ins, and we have a tenant education seminar. So we're truly trying to build a system or a culture of accountability with our renters, and also kind of reassuring those landlords that they have support. Last two things I'll talk about is the land trust project that we have coming through our Summit Hill Community Development Corporation. This was in partnership with the city of Bloomington. We're partnering with a builder with efficient housing structure to lower costs, to obtain affordability. The thing about this is that the ownership of the land will be retained by the CDC, and the first option to buy the home always goes back to the CDC with the split equity structure built in to maintain the affordability. And so hopefully this is the first of many additional developments for affordable home ownership here in Monroe County. We have a potential project for integrative supportive housing that will support, actually it's on the old hospital site in partnership with the city. That was the core building. We're still pending some approvals and a tax credit application, but 25% of those units will be reserved for individuals, low-income individuals with disabilities, with Section 811 vouchers, and we'll have some also affordability, general affordability for that project. So some things that the Housing Authority is doing is connected. I try to put a lot in there. Yeah. Yep.
Okay, great. I'm back. I'm going to talk about Heading Home. Hopefully you have heard about our organization. We're really a backbone to support the work that a lot of these agencies are doing on a regional level. This was something that we actually inherited from some really hard work that the South Central Housing Network did in 2014. They put together a strategic plan called the Heading Home Plan. But unfortunately, like many other things that you've probably experienced, if there's not anyone charged with helping implement that plan, sometimes it doesn't go very far. So fast forward to 2020, 2021, during the pandemic, when it became very clear that we did have a crisis that was growing in our community for housing security, the Community Foundation of Bloomington and Monroe County, the United Way of Monroe County, the City of Bloomington, Monroe County government, and several others came together, created a working group, and said, let's update that Heading Home plan. Happily, it also coincided with the availability of federal funding. So when that working group updated the plan, there was funding available to support some staff that could help implement the plan. And that's what really Heading Home is all about. I work in connection and in partnership with Tatiana Wheeler, who is sitting in the back here. She's been instrumental in moving some of these projects forward, and I just couldn't have done it without her. I'm going to just give some highlights of the projects that we're working on throughout the region. There at the table when you came in, there's a handout that has some of our a longer list of our projects, and I'd be happy to share that with you electronically too as a follow-up. Well, as I said, this is our mission, to decrease homelessness and housing security by partnering with many of the people that you've already heard from tonight and many others in the community. Our vision is to make homelessness rare, brief, and non-repeating. It's really a regional effort. We couldn't do it if we just focused on Bloomington or even Monroe County. So our work is broader than that, although a lot of what we do is based here. We look for efforts that cannot be done by any single agency, but that would benefit the entire system. So this is a project that we worked on. Actually, we contracted with Deborah Meyerson, who you'll be hearing from next, to put together a comprehensive housing guide with other resources. We heard that agencies themselves were keeping these lists, so we're trying to provide some support for those folks with a commitment to update it regularly. It's called the Heading Home Guide, and it's at headinghomeguide.org. We also really have spent a lot of time over the past year working with a national organization called Built for Zero. Built for Zero is working with over 100 communities in this country and some internationally to provide a data-driven approach to decreasing homelessness and getting it down to what's called functional zero. We really are appreciative of the coaches that Built for Zero provides because they are tapping into not only their expertise, but the expertise of other communities that are far ahead of us in working on this issue. So we're able to connect, and it's been really valuable. Oops, I'm just going to mention one more thing about Built for Zero. I forgot what the slide said. We hope to very soon, in the next few months, create a public data dashboard so that we will be able to provide the community with a more accurate snapshot of what's actually happening at any given time. Earlier, you heard about the point-in-time count, which happens once a year. And that's kind of been what the data that we have relied on to gauge what our situation is. But we would like to do this on a monthly basis. We would like to have contributions from all of the agencies that are providing data in their own, from their own perspective. And we're working towards that. We're not quite there yet, but hopefully this summer we'll be able to launch that. Another initiative that we've been supporting is veteran case conferencing. And many of the people in this room are working on that. It's really an extension of the coordinated entry that Danielle mentioned earlier. And the focus is really on just the population of veterans who are experiencing homelessness. In part, this is some advice that our Built for Zero coaches gave us, is that rather than trying to tackle the entire system at a time, is to look at segments of the population and where we might be able to marshal more resources and move people more quickly into housing. So we chose veterans. A lot of communities do that. It's a smaller subpopulation. There are a lot of resources available for housing vets. So this group, you can see some of the people who are in this room too. This group comes together every other week and literally just goes through the list of veterans who are experiencing homelessness and get a status report and then identify next steps to moving that person into homelessness. It's really been a great way to overcome some barriers more quickly than might have otherwise been possible. And we hope that we can use this model as a community in a region to extend it to other subpopulations of people that are experiencing homelessness. I feel like I went through that really fast, so that gives more time to Deborah Meyerson, who is handling a really important function for this evening, which is providing some concrete advice to you as future council members on what the city council can do to help strengthen housing security and tackle some of these really challenging problems. So I'm going to hand it over to Deborah. Thanks.
So as Mary said, this is going to kind of turn some of the thought and questions to folks here tonight, council members, future council members, folks in the community. But it's amazing to see what the agencies in our community do. They do an incredible amount. But we're going to look about how we can have that as a continued partnership and how council can be part of strengthening housing security. So the focus of this is certainly more the homelessness end because that's where the Heading Home plan is. But just it helps to look at this continuum of housing needs. And what I really like about this graphic is that, I don't know what's helpful to use this. What I like about this graphic is that it starts out on the left with homelessness and emergency shelter. It continues through to transitional housing, affordable rental, affordable home ownership, market rental, market home. But then it also has, again, it's probably small, I can't see it all, but just what are the things that help you move from one to the other, right? And that's where all the services that you've heard about today, so many of them come in, whether it's improved employment, stability, families connecting with services. So just understanding how that continuum happens and how we can support that continuum, because homelessness and emergency shelter are important, but we want people to be in stable housing. So a quick snapshot of the state of Indiana, just in terms of housing costs, and then we'll drill in more locally. But just statewide, and this is again focusing on rental housing, but it's looking at cost burden. So we've got extremely low income, very low, low income, middle income, and then the difference cost burdened, which is it's considered affordable if you are spending no more than 30% of your income on housing costs. So cost burden, so that's the blue. So the people who are extremely low income are spending 87% of them are cost burdened. And then severely cost burdened is if you're spending 50% or more of your income on housing. And so you can see that's still extremely high, and it stays, the cost burden still stays high, and eventually drops a bit, but there's a lot of folks that are dealing with struggles. And that, of course, compromises their ability to pay for food, health care, and creates more opportunities for evictions, et cetera. So again, statewide housing snapshot. Before I start drilling down locally, I'm interested, if you wanted a local document to help you with housing policy, said, okay, I want to do something on the ground, what would you pick from? Just shout out what you know of that is available, focused on the local community, Bloomington, Monroe County, to support housing needs. Sure. What kind of policy or program plans, any of the three, program, policy, plans, if you wanted to pull something off the shelf, say, I need to know more about housing policy that would affect the city of Bloomington, or that's relevant, well, Monroe County, but we're focusing mostly on the city here. What would you pull off the shelf? Okay, heading home. What else? Yeah. Rent control, I'm not talking though, I'm talking about like what already exists. Rent control is great in terms of just what policies are possible, but they've already been published. We have them. They've been done, they've been published. Some of y'all may have approved some of them and adopted them. So what would you pull off the shelf? Right, United Way has the survey that they do, that's helpful. Alice, that's I think that's the CAP program produces that, right? So Alice is got to remember how the acronym stands for, but it measures your right people who are housed, but kind of how their resources are being spent. Any other documents, Forrest? Bloomington Housing Study and our comprehensive plan. Thank you. Those two on my list. Did you have another? Okay, so we're starting to get in the direction that I'm heading in. So Matt said the Bloomington Housing Study, the comprehensive plan, and then the ROI had their 11 county area did some studies. So here's the list that I came up with at least. Okay, so Heading Home is at the top there. And these are all done in like the last 5 years, okay? The comprehensive plan, the Unified Development Ordinance, so the plan is kind of the big idea, the big vision. The UDO helps to, that's the regulation, that's the law, right? HAND has their Housing and Neighborhood Development Consolidated Plan, lots of good info in there. The Analysis of Impediments to Fair Housing Choice, which is fair housing questions, also within underhand. The Bloomington Housing Study that was mentioned, the Monroe County Quality of Place and Workforce Attraction Plan, some good stuff in there. And then this is the ROI study, also known as the Indiana Uplands Housing Study, which they're currently updating. So you can see there's 8 different documents here. It's by no means comprehensive, but it's a pretty good spread. And I would say that collectively, the documents and information in here help to get towards what I've got in my shirt: safe, affordable, accessible, not discrimination-free housing for all. So this helps you get there. And if you're pulling just one, there's some other things that you may be missing. So this is a good place to start. And here's some things of how to use these resources: new policies and programs, previous recommendations, Finding housing data. Maybe you have a housing element that you want to pursue. You're like, well, how can I find the data I want to really show that this is needed? These documents have a lot of good info. Again, they've all been produced in the last 5 years. Best practices from other communities. I know that I think it's RDG is the consulting firm that did the ROI plan. They've got some nice stuff, and they also did the Bloomington Housing Plan. They've got some good stuff in there. If you want to know, well, who else is doing stuff like this? Has good gaps in information. You might say, well, how do we know this? These documents don't have everything we need. You might say, well, there's still more information we need, and this doesn't cover it. So it helps to kind of identify where those gaps are. And then finally, looking at it like, well, this was good 5 years ago, but here's some stuff that's changed. We might need to update this. So we're going to start with a little exercise, an example from the Heading Home Plan, and we're going to look at how to coordinate with other documents from that list of like, how do we use this? So Heading Home Plan. The example that we chose to look at, we're going to focus on this objective, but it starts with goal number 1, making homelessness rare, investing in strategies to prevent homelessness. Increasing housing stock. We heard a lot about services, which are terrific, but the biggest thing to reduce homelessness is housing, okay? Getting people housing. So increasing it for low income, extreme poverty. Again, you saw that bar chart for the state of Indiana. You saw the biggest challenges for those low income folks. So the objective, what affordable alternatives do we have? Someone was asking me today, what do you think people should know? Like, what's the biggest thing that people miss about housing? And part of it's just new construction is expensive, right? So you're not going to get automatic affordability just by, hey, let's build more housing. Supply is good. It helps with more competition for prices. Yeah, that's all good stuff. But to get to this very low income, you need to figure out you can either lower the cost of housing or raise people's incomes. And for extremely low folks, even if you raise their incomes, it's still going to be hard to meet the cost of housing. So here's the proposal in the Heading Home Plan. Tiny homes, converting hotels to single-room occupancy, home shares, all good ideas. So here's what we're going to do. What documents, how would you do that? Say, okay, great ideas in the Heading Home Plan. Let's go ahead. Let's do it. Let's build tiny homes. Let's convert hotels. Let's do home shares. Well, hey, let's take a look at the comprehensive plan. Does the comprehensive plan support this? Is it coordinated? And it looks pretty good. We've got housing affordability, we've got housing supply, we've got neighborhood stabilization, all good stuff, supported well in the comp plan. You can look at that further on your own, but I just want to show, yeah, okay, good, check, that coordinates. Next, we're going to look at the UDO, because the UDO, as I said, that's the law, right? Comp plan is the vision, shows where we'd like to go. The UDO shows how do we build it on the ground. Single room occupancy. And I'm not the lawyer in the house. You can talk to the planning department. They might say, oh yeah, SRO is under this. I did a search, 482 pages, whatever. And I couldn't find any reference to SROs in there. So I don't know if you can build them. It's a good question to ask. Can't find evidence of that. Tiny homes, those are mentioned in the plan. But they often have obstacles because they don't often meet applicable building codes. Where they are mentioned in the plan, it says, well, they have to comply. Great, let's let them comply. But that's kind of a gap, like, let's say they should comply, but often they don't. And then finally, home share options. That's great, we'll do a Golden Girls kind of thing. But as many folks know, there's a limit on occupancy of unrelated folks in the city of Bloomington. So in order to fulfill that goal in the Heading Home Plan, you'd need to look, can you do it? Can you build it? And so these are some things that require some more investigation. So that's an example of saying, okay, community goals, Heading Home Plan, it's supported by the comp plan for the city. Can we do it? That's just an example. So implementing the action items. How can you take this example? Your homework is to continue looking, whether Heading Home Plan, aspirations in the comp plan, How can you put this stuff together? So priorities through outreach, talking to, folks who are out canvassing now, getting a feel for what people think is needed, communication with our stakeholders, the agencies who are here, et cetera. Talking with prospective partners, because no one agency or entity can do this by themselves, right? It takes the collaboration. And so things like utilities, the 3 things you need to build housing to make it feasible: you've got the land, you need to have the fire codes be coordinated, you need to have access to utilities, and you need to have zoning in place. If you don't have all 3, you can't build it. So you need to talk with these other departments to make sure that you have access to utilities, that the building codes can support what you're building. Who has responsibility? Part of this section is really to encourage a culture of action among council members, right? To say, how can you look at what's out there for housing and connect it and bring it forward? And so if you look at who has responsibility for the element that you're talking about, that can help drive that forward. And finally, communicating council priorities, if it's a resolution of support, if it's in the budget, if it's in policy, using council comment time to make the comments, and many folks do a great job with that, but just encouraging to consider it in this context. And so I'll conclude with cultivating a culture of action, right? So homework, pick a recommendation from the Heading Home document, okay? And take a look at how other documents, of those 8 documents, or maybe others that you've thought of, support that, or if they don't, why not? And how can that be coordinated? And then from either samples that I've suggested or other things that you know would be important, how do you bring those together? How do you move that forward? Because plans are great, but if they're just sitting on the shelf, they're not going anywhere. So, thank you.
All right, now we're going to turn it to you. You've heard a lot of information tonight from a lot of experts. We also have people in the audience who are working in this field who didn't speak, but they can be here to help answer your questions. What questions do you have about the material that we covered tonight, or just housing security in general, or your role in helping solve some of these problems or address some of these problems? Yeah, Isabel? I'm going to let you answer this, Danielle. The question was, is Wheeler Mission part of coordinated entry because they don't get federal money?
We're working on it. A big part of the Built for Zero initiative is to get as many providers participating in coordinated entry as possible, because we want to have accurate data. And we can't do that when we have over 100 people sleeping at Wheeler every night that aren't being counted. So Tatiana's been working hard with them, going over there and doing the vulnerability assessments herself. And Wheeler has been really getting more involved than they ever have been in the past, and has agreed to have their case managers start doing the vulnerability assessments as well. They've not yet started attending our case conferencing meetings, and they've not yet started assessing every single person that comes through their doors, as coordinated entry directs us to do. But we have made more progress with them in the last year, thanks to Mary and thanks to Tatiana, than we ever have in the past, as far as them working with the other agencies in town.
Thanks. Did that answer your question? Great. Yeah.
First, thanks and wow. Okay. Second of all, I apologize if I missed this. Can we get a copy of the slide deck?
Yes, absolutely. By sending everybody who registered and all the candidates.
And then my ultimate question, I appreciate what you've laid out in terms of just the multi-pronged approach we take to issues of housing. Where would additional resources have the biggest impact, in your opinion? Is it more caseworkers? Is it more money in the landlord mitigation fund? Is it more eviction prevention? If more resources, financial resources, became available, where should they go?
That's a great question, and I will open it up to anyone else here who would like to take a stab at it. I would say the two biggest needs are additional housing units. So how can we build more units or open units that are not currently being rented to people with housing vouchers? And then case management, because a lot of this work relies on the people who are actually in the trenches and providing the services that you've heard about tonight. John Zodi, the director of HAND, has done a recent assessment, and I think those are the two of the priorities that you've identified in talking with community members. But I'm going to open it up and see if anybody else here would like to address that. Yeah. I'm going to bring the microphone to you.
Yeah, I'll just piggyback again, Melissa from HealthNet Homeless Initiative Program. I know we talked to John, but I think what our street outreach case managers do, case management especially, and I think it's also not just pre-housing, but post-housing in terms of supportive services. So helping somebody who may have been experiencing homelessness for 10 plus years, moving them into brick and mortar and, again, learning how to maintain that housing from cooking, cleaning, being a good tenant, things like that. Because we find, we get folks housed, but then unfortunately, our street outreach case managers have to move on to other folks. And so they're not able to provide that sustainability case management, which is really important to maintaining the housing.
Anybody else? Emily.
Yeah, I heard Deb say this and I heard Mary say it, but I just want to amplify it. Housing is always the answer, right? Sometimes we get asked questions about homelessness or we ask candidates questions about homelessness and we hear answers from candidates about mental health. Or we hear answers from candidates about job training. Mental health is not the cause of homelessness. A lack of homes is the cause of homelessness, right? A lack of job is not the cause of homelessness. A lack of homes is the cause of homelessness. So absolutely, we need more case managers. We need more resources. Like many other frontline workers, people are leaving this profession, right? It's underpaid. It is a tremendous amount of emotional labor. And so I think Mary really hit the nail on the head.
One of the things that I think is important is not only housing, but what price range that the housing is built in. And one of the most important statistics or information that came out of the ROI study was looking at housing availability based on price relative to income. And what they showed is that basically we have these numbers are dated a little bit, so the numbers are probably higher now, but we had in the 400 to 800 rental range, we have an excess, believe it or not, of housing. And in the 0 to 400 range, we have a severe shortage in terms of the amount that's available. And so what's happening is that people are moving from the zero, who should be having rental ranges in the 0 to 400 range, are moving into the 400 to 800 range and filling that up. And then some. And most of our housing, affordable housing that we build is in the 400 to 800 or higher range. So when we talk about affordable housing, we're not building in the range that's in the glut. And that's a real problem. And so from my perspective, the only way to really tackle that I think there's lots of things we talked about, the market and all that, and the market solutions, but I don't think the market's ever going to get at that 0 to 400 range. And so that means subsidy. That means we have to invest money in people and places and buildings that they can get to that price range for people. And we really have to be thinking about, if we're building affordable housing, are we building it in the place that we actually have a gap? Yeah.
Anyone else want to answer, take a crack at answering that? Thank you, Forrest and Emily and Melissa. All right, yeah, Kate.
Thanks for doing this tonight. Okay, I have a question around advocacy for this, I would say, and data-driven decisions. Okay, so, oh, is this? Hi there, okay. I have questions around advocacy for this work and data-driven decisions. So some council members in this room worked with a lot of people also in this room to create an ordinance, write an ordinance to decriminalize homelessness that was met with wild opposition, I would say, in council. And so what can we do as council members, right, to work with you all, and what are you all allowed to do, like if you're a nonprofit or if you're not a nonprofit, to advocate for what the data is saying we should do? Because a lot of these decisions and a lot of the steps that we need to take are pretty major. They're pretty bold. I mean, changing the UDO is something that needs to happen. Right now, we can't have tiny homes usually on most of our properties, right? We can't have duplexes by right in our walkable neighborhoods. So, I mean, the idea of converting small hotels or smaller buildings into single room occupancy units is just so far from where we are right now, but like I would love to work on that. And so I guess I would like to hear from folks, like how can we help you, and what can you legally do to help us?
Who would like to take a crack at that? Deb.
It takes partly just getting used to the ideas, identifying where the ideas are, like, oh, UDO isn't, I mean, talking about SROs and how do we do that? And so it's communication, it's outreach, it's elections, just because all of that has an impact on how this works. So again, multi-pronged solutions, multi-pronged ways to get to those solutions too. So I don't have, unfortunately, one simple answer for that question. I think it's an important question and a good one, and one that we need to keep asking, of how do we work together to, this Heading Home plan was a community-based plan that was put together by a huge number of stakeholders throughout the community that put this together. And it's terrific that Mary's organization is there to help drive that forward. But we can't let Mary and Tatiana can't do it by themselves, right? And so it's a matter of figuring out how do we connect the dots. And that was getting back to like those documents, like there's a lot of work that's been done. How do we connect it with Heading Home? So unfortunately, I don't have, again, one answer, but multiple answers. And it's building the relationships, getting people comfortable with what the needs are, and getting decision makers who can push that forward, getting the critical mass to do that. So that's how I would answer that. Others may have others to add.
Take it this way. I will just say that Tatiana and I spent an extraordinary number of hours and days and weeks and months building relationships, which Deborah mentioned, and I feel like these are they can be very divisive issues, and if you don't have any prior relationship to the people that you're trying to persuade to do something, I think it's easy to just go off the rails. We talked about Wheeler Mission earlier. That took a lot of time, just meeting with the folks at Wheeler and talking about what their pain points are. Why are they, people don't act out of, well, most people don't act out of wild, irrational decision. They have a reason why they're taking a certain approach to something. And so just understanding what that is and trying to move things more closer to each other, because I think we start out by saying, well, we're so far apart. And maybe we are, but part of it is just understanding what those positions are and how we can move people to feel more comfortable being in a place we think we need to be. Anyone else? Yeah, Emily.
So I think, thanks, Kate. As most of us who spoke tonight are leaders of nonprofits, so we cannot advocate for candidates. We can advocate for issues. And most importantly, what we can do is talk to you anytime you have a question about why something like this would be important. And the other thing that we can do for you is to come with you to talk to your constituents about it, how it might impact a neighborhood to change something, or what we could do to mitigate some of the negative effects that people are afraid of. I think oftentimes we talk about changing anything about someone's neighborhood, it gets scary. And so anything that we can do to make that less scary, we're here for that game. And I think the last thing that we need from you, and this is a hard thing, and it's hard for us, and it's hard for everyone, and it may sound kind of dumb, but one of the things that we do all the time as nonprofits to survive, because we have to raise money, is we work with people we disagree with on things that we agree on, right? And so there are a lot of people that I hang around with, that I talk to, and I think, gosh, we don't agree on anything except for that we don't want any kids sleeping outside tonight. And I think that is something that's really difficult to do in our climate. But gosh, if you guys would be willing to take that approach, we'd sure be there to back you up.
Very, very well said. Anyone else want to respond to that, to Kate's comment, question? Oh, okay. Other questions? Yep.
I agree with a lot of what Kate said. I don't need one. I'll just speak.
I think Katz might need one.
All right. I want to first say I agree with everything that Kate said. I want to endorse what she said. But there's a specific question I've been wanting to ask for a long time, and I think there are certain providers here who could answer it. To me, there's been a lot of heat and argument over development and developers, but to me, the biggest stumbling block to the advent of newly built housing in this community at the points that people like Forrest and Emily are talking about are not the developers, but the financiers of the developers. So who here can speak to the relationships that we have with banks that would allow the kind of development that's not market rate, that's not attractive, that they don't really want to get involved with because it's complicated? Is there any development on that end, wrong word, the movement on that end towards getting bankers to be in this room with all these other providers? Or is it hopeless to think that regular banks won't take part in this and that we have to depend only on, say, a CDFI or a credit union or maybe even more unusual financing sources? Can anyone speak to that?
Leon, is that what you? Okay, yeah, great.
As I mentioned, the Housing Authority is just getting into the development space through Summit Hill. And with that, oh, yeah, sorry. So yeah, with the undertaking of the Summit Hill CDC, we've been in that space of development and working with financial institutions like, for instance, Senaire is affordable housing friendly financial supporter of a few projects that we've done for our Senaire. Senaire is yeah, so they're a very affordable housing friendly, working with the affordable the LIHTC program. Additionally, with our Summit Hill, with the land trust, we've been working, well, my director of real estate development is not here, but he's been working very intentionally with finding folks who actually finance mortgages to work with our homeowners, which is a big part of it as well. And so we are doing that work actively now for some of the undertakings that we're doing, and additionally with the proposed core project as well. So
maybe I should just ask, do you feel that you have access to financing for new construction if and when you need it? It's difficult. We're going through a lot of different avenues, seeking funding through the Federal Home Loan Bank, all the usual players that we are aware of, and that generally includes tax credits. So, not yet. Yeah. John may have more.
I'll speak to some. Thanks, Leon, and Steve, to your question. So, from the city perspective, the city's not on new housing development. The city's not necessarily looking for investors who would help us build housing. The development community is really taking that on. The city comes in as a partner incentives that we have to offer, as you know, Steve. And so one thing where we can grow, and we're kind of actively figuring out our plan for that, is how to get more lenders engaged in our down payment closing cost programs. So for home ownership, you were asking about new housing development, which I understand. But one of the things that we're trying to get lenders more engaged on is engaging in the shared appreciation program, which is basically a down payment, a shared equity program that Leon mentioned that we have at the city, because that is a unique financial model for banks. And so we just hired a new program manager, for instance, for housing, and one of her jobs is to do sort of that outreach, not just with the lending community, but also with realtors who can try to engage those clients who may not be in as competitive of a situation as others who might be able to offer cash or whatever. And if it's a first-time home buyer, can say, I'm going to work with you and we're going to get you in a house. We're going to find a lender and we're going to help access these programs, because there are a lot of people who may not know that the programs exist. So we're trying to get the word out on those. So different answer to your question about financing. But as far as financing on the real estate or on the affordable development, as Leon mentioned, the core building is one of the projects where that project will go in for a low-income housing tax credit project, a very competitive state program that utilizes the federal low-income housing tax credit. And if that's awarded, tax credit investors such as Senair that he mentioned are folks who buy those tax credits and they become a partner in the project. And the city doesn't, we help create the environment, so that project will come to us and say, do you have HUD dollars you could help provide us, or do you have housing development fund or whatever? So we offer different kinds of incentives to help reduce the cost of the overall project to make it more affordable.
Thanks, John. We are coming close to the end of our evening. I'm going to take one more question because you have had your hand up and I keep not talking.
It's a quick question. I was just wondering, what resources are available to teenagers experiencing houselessness?
That is a great question. There used to be a program called Stepping Stones, which was run by Centerstone. They are currently trying to find some funding, but they have changed that so that it would be older young adults, 18 to 24. Am I right on that? Yeah. Okay. And then for the general question, who wants to field that? What are their, Chase, why don't you come over here?
For minor children who are with their parents, they can get shelter and services at New Hope for Families and a couple other shelters in our region. For unaccompanied youth, it was Stepping Stones and the Youth Services Bureau, which is a county-run youth shelter.
Great, thank you. Okay, I know some of you still have pending questions. Our speakers are going to be hanging around a little bit if you want to talk to them, but we want to get you out of here on time. First of all, please give a round of applause to all the folks who are here tonight working on housing security. I hope your takeaway is that we as a community are very collaborative. We have a lot of work to do, but we have done a lot so far and continue to be passionate and intentional about how we can strengthen housing security in this region. I will be following up to everyone who's registered, who has given us their email with handouts related to the topics as well as the slides that you've seen tonight. I appreciate that you are all running for office. It is very important, and it can change the outcome of people's lives, literally, your decisions. So thank you again, and have a great night.